The top stories tonight in One News. Many scientists believe that the SARS-CoV-2 coronavirus will not be eradicated amid the immunization efforts around the world.
The government assures it will not reimpose a stricter COVID-19 lockdown amid the increasing COVID-19 cases in the country.
Several hospitals in Metro Manila have stopped accepting outpatients amid the growing number of COVID-19 admissions in hospitals. The government to probe deaths of activists in deadly Calabarzon raids.
Senator proposes an exit plan for overseas household helpers in the Middle East who are victims of abuse.
And Singapore's massive floating solar farm aims to fight climate crisis. Good evening, Philippines and the world. Today is Monday, March 8, 2021. I am Jorge Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. A recent survey shows that many scientists believe that the COVID-19 virus will become endemic, circulating in population for years to come. Nina Bascon reports.
A survey conducted by Nature, a research journal publications, reveals that researchers and virologists think that getting rid of coronavirus is unrealistic. Nature asked 100 immunologists and infectious disease scientists whether this virus could be eradicated. Around 90% think that COVID-19 will become endemic, meaning that it will continue to be transmitted in the population in the coming years. According to Michael Osterholm, an epidemiologist at the University of Minnesota, eliminating the virus is impossible. But failure to completely eradicate the coronavirus does not mean that the situation we see in the world with the new normal of lockdowns, mask and social distancing and deaths will continue on the scales we've seen. Biologist Jess Bloom at the Fred Hutchinson Cancer Research Center thinks that similar to the influenza pandemic in 1918, it is possible for coronavirus to settle into seasonal outbreaks if population has some immunity. According to Christopher Dye from the University of Oxford, some countries might be able to eradicate COVID-19, but those with less vaccine coverage and not good public health will have it difficult. In the flowchart presented by Nature, some factors that will lead to COVID-19 being endemic are vaccine coverage and effectivity, herd immunity, virus mutation, and effect in animal reservoirs. It is still challenging to predict how the world situation with coronavirus will be, but Osterholm advises countries not to abandon their strategies to reduce the spread of the virus. Nina Bascon, UNTV News and Rescue. We serve the people. We give glory to God.
As the country is nearly a year under community quarantine, presidential spokesperson Secretary Harry Roque touts the government's excellent response to control the COVID-19 pandemic. But with the increasing cases of COVID-19 in the country, the palace official says reimposing a stricter quarantine classification is unnecessary. Rosalie Pons explains why.
The government says the Philippines' response against the coronavirus pandemic is excellent. This despite being second in the ASEAN countries with the highest COVID-19 cases, with almost 600,000 and more than 12,500 COVID-19 deaths. Presidential spokesperson Harry Roque compares the country with developed ones which are severely impacted by the pandemic.
We were excellent. Na-control po natin ang pagkalat ng sakit, lalong-lalo na kung ikukumpira tayo sa mas mayayaman at mga bansa na mas mararami at mas moderno mga hospital. Hindi po tayo nasa top 5, hindi po tayo nasa top 10, hindi po tayo nasa top 15, hindi tayo nasa top 20, hindi tayo nasa top 25.
Almost a year has passed since the community quarantine has been implemented in the country because of the pandemic. The palace is also confident the prediction of the UP Octa research team will not happen. The independent research group warned that the country may reach 6,000 COVID-19 cases per day by the end of March. However, the government pleads the public to maintain strict adherence to the minimum public health standards. According to presidential spokesperson Roque, implementing stricter community quarantine in the country is not necessary because local government units can order localized or granular lockdown in certain areas with high infection rate. He adds our healthcare capacity can still accommodate severe infections.
For the month of March, I don't think it is called for. Bakit po? Kasi talagang datos po ang ating pinagbabasihan. Sabihin na nating dumami ang kaso, pero nakikita naman natin handa tayong gamutin yung mga seryoso magkakasakit na 2 to 3% ng mga magkakasakit.
Rosalie Coz, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Department of Health believes that the existence of COVID-19 variants is not the sole reason in the rising cases of COVID-19 in the country. Meanwhile, local government units are urged to implement localized lockdowns on areas with high transmission cases. Aiko Miguel explains why.
The Department of Health remains open for studies and projection by experts in the Philippines, but the public has to understand too that COVID-19 variants are not the sole reason of the increase of COVID-19 cases in the country. Another factor the DOH sees is the complacency of Filipinos in observing health protocols. The DOH reiterates there is no proven community transmission yet due to COVID-19 variants in the Philippines.
Wala po tayong confirmed community transmission as of yet. Kailangan pa natin i-further investigate. Humingi na po tayo ng tulong sa World Health Organization. We had a meeting with them last Friday para matulungan tayo to further analyze ito pong sitwasyon na meron tayo sa ngayon. So antayin po natin ang further naming pag-aaral para makapagbigay tayo ng tamang impormasyon sa lahat.
The DOH is also considering Octa research team's projection of a possible increase of 5,000 to 6,000 cases per day in the country by the end of March with the existence of COVID-19 variants. According to Undersecretary Vergere, they have given their recommendation on a more active COVID-19 response.
Tatawagin na namin ito ngayong intensive public health standard. Localized response ang atin pong unang rekomendasyon. Alam po natin na ang stricter lockdowns or region-wide lockdowns are really not the only measures for us to prevent the further transmission of this disease.
The DOH has instructed LGUs to do contact tracing in 24 hours to do testing, isolation, and quarantine measures to immediately cut the transmission. The Health Department reminds the public that there is nothing more effective in the prevention of COVID-19 infection than to be more serious and responsible in following the minimum public health standards. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The local government of Pasay has lifted the localized community quarantine in 20 barangays in the city over the weekend. Meanwhile, the city's general hospital has recorded an increasing occupancy rate for COVID-19 patients. Janice Ingente reports why.
20 barangays in Pasay City already finished their 14-day quarantine on March 5. Among 65 remaining barangays under localized lockdown, only Barangay 183 is still in total lockdown. In an interview, Pasay City Mayor Emmy Calixto Rubiano said, from an average of 100 cases daily in the previous weeks, they were able to bring down the infections to just between 60 to 80 patients daily last week. Mayor Rubiano added that the decrease of the number of COVID-19 cases is because of the efforts of their contact tracing and their strict implementation of basic health and safety protocols. Yesterday, the city has recorded 74 new cases of COVID-19, and as of March 7, Pasay City has 515 COVID-19 active cases. Meanwhile, Pasay City General Hospital has recorded 67% occupancy rate for COVID-19 patients. Out of 49 bed capacities, 33 has been occupied with patients.
We cater to the moderate risk hanggang sa critical risk na mga COVID patients. We don't handle mild or asymptomatic cases sa quarantine facility yon.
Despite this, Dr. Jan Victor Di Gracia, the hospital's officer in charge, said they can still accommodate the COVID-19 patients.
So far, kaya po namin i-handle yung mga surge ng cases ng COVID dito sa Pasay City General Hospital. So as expected, pag dumating sa amin dito, medyo talagang may sakit sila or kaya malubha na sila. Mas marami pa rin naman po kaming napapauwi ng mga pasyente.
Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
Manila City Mayor Isko Moreno Dumagoso warns that he may place the entire city under lockdown. Dante Amento tells us why.
Manila City has recorded 202 new confirmed COVID-19 cases today. This is high compared to the past few months. In a meeting this morning, Mayor Isko Moreno Dumagoso ordered the Manila Police District to increase police presence in key areas to strengthen security and enforcement of health protocols. The Manila Barangay Bureau is also authorized to implement barangay-level lockdowns. But Dumagoso stresses if the cases will continue to increase, he will not hesitate to put the entire city under lockdown.
Hindi ako mangingimi. Isarado ang Maynila. Whether 1 day, 3 days, or 1 week. If that is the way to protect each and everyone. Because while we adapt to the economic challenges brought by this dreadful disease, and we really must be aggressive in sustaining whatever is left with regard to businesses and available jobs.
Dumagoso had recently placed Tondo and Sampaloc under total lockdown due to the high number of coronavirus infections. The local chief executive also appealed especially to the parents not to allow their children to go outdoors. Meanwhile, Dumagoso has confirmed that 4 City Hall employees tested positive of COVID-19, but they are now in stable condition. The local government advises those who have transactions at the City Hall to do it online. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
For those watching us on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. Several hospitals in Metro Manila have temporarily stopped accepting patients in its outpatient department amid the growing number of COVID-19 admissions in their facility. Ray Pelayo will tell us why.
The Philippine General Hospital has admitted 105 COVID-19 patients in the past week. This is higher than the 60 to 70 COVID-19 cases in the past months. PGH spokesperson Dr. Jonas Del Rosario said that the increase is possibly due to the loosening of the quarantine restrictions, including the presence of the COVID-19 variants. Out of the 30 specimen they sent to be tested, 1 tested positive for the variant found in South Africa.
I think yung pag-open at ngayon ay mas maraming tao na nagtatagpo-tagpo. Pangalawa po ay may possibility rin po nga na yung variants ay meron din kinalaman doon dahil dito pong mga variants yung UK and South Africa, sabi nila ay mas mabilis pong kumalat o makahawa.
The hospital with only 140 bed capacity for COVID-19 cases has started to prepare more beds and open up more wards to cater to patient demand.
Nakikipag-coordinate na rin kami dahil may mga iba po mga ospital, kaunti lang naman po yung naka-admit pa, kaya humingi po kami ng tulong para hindi naman po masyadong mapuno yung PGH.
PGH has temporarily stopped accepting patients in its outpatient department to prevent the further spread of COVID-19 in the facility. Del Rosario said an online appointment is necessary before patients are allowed to have a face-to-face consultation with their physicians. There are now 15 health workers who are positive of the virus, while 80 others are on quarantine. Meanwhile, Dr. Jose Rodriguez Memorial Hospital and Sanitarium in Caloocan has 85 COVID-19 patients as compared to the 45 to 50 patients last week. The hospital's medical chief said that violations of minimum health protocol is the most probable reason for the increasing trend.
Yung iba ang kinikwento nila, ay may face mask kami pero wala sa face. May face shield kami pero wala sa face. Dikit-dikit ako sa palengke eh. May kami family gathering, imposible namang 2 meters pa, dikit kami.
The outpatient department clinics of the Jose Abad Santos General Hospital in Manila is also closed due to the COVID-19 cases surge. The Department of Health assures that the country's health system capacity is not yet full, but they already talked to hospital directors to prepare for the possible surge.
We went around, no? Nakita natin na dumadami po talaga ang mga tao sa ER, yung mga may mga suspects, no? Or yung mga may mga simptomas ng COVID. Pero to say that the system is overwhelmed, no. Pag tinignan po natin ang healthcare utilization natin, we still are at that manageable level na meron pa tayong almost 50% na pwede pang maka-accommodate ng ating mga pasyente.
Ray Pelayo, UNTV News and Rescue, we serve the people, we give glory to God.
Healthcare workers in the country might request for another time out. Meanwhile, a University of the Philippines Octo research team says that international travel protocols need re-evaluation. Here's why from Marvin Calas.
Although travel restriction policies in the Philippines are in place, the University of the Philippines Octo research team still recommends even stricter protocols. This is due to the increasing number of new COVID-19 cases recorded recently in the country, particularly in Metro Manila. Professor Guido David of Octa Research notes that international travel protocols need to be re-evaluated as new COVID-19 variants were able to enter the Philippines.
We're not saying to have travel bans from international travel bans, but what we're seeing is, fact is the variants are here, UK and South African variants, and we did not prevent them from entering the country. And this will disrupt our economy if we keep letting, viruses from other countries come in the Philippines. And kung makapasok yung Brazilian variant, that's even worse, a worse nightmare than yung South African and yung UK variant.
UP Octa Research is also alarmed over the possibility that health workers might request for another time out in case the country's healthcare system reaches its full capacity.
Before, noong August, umabot tayo ng average of 4,500 cases. So in fact, yung projection natin will exceed that. So we think na at that level, baka humingi na nga ng time out yung mga healthcare workers natin. If we let it run to 5,000 to 6,000 cases per day, it would be very critical for the country. And that's why we're sounding the alarm now.
The team also reminds the public for the importance of following the minimum health standards that could prevent the imposition of tighter quarantine restrictions. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
The nationwide count of coronavirus disease cases is now nearing 600,000. The Department of Health recorded 3,356 new cases today, bringing the total number of cases to 597,763. The DOH said there were 39,330 active COVID-19 cases in the country. Of the active cases, 91.2 were mild cases, 4.0% were asymptomatic cases, 2.0% were critical cases, 2.0% were severe cases, and 0.83% were moderate cases. The case bulletin of the DOH also showed 61 new recoveries and 5 new deaths. This means there are now 545,913 total recoveries and 12,521 total deaths.
The Department of Health has instructed hospitals to set a separate schedule on the rollout of Sinovac and AstraZeneca vaccines. Aiko Miguel will tell us why.
Hospitals have set their schedule on when to conduct the inoculation of CoronaVac of Sinovac Biotech and AstraZeneca COVID-19 vaccines. According to the DOH, they have instructed hospital officials for a proper inoculation system.
They should not vaccinate different types of vaccine in a given day. Halimbawa, nag-schedule sila ng Sinovac ngayon, bukas ka na mag-schedule ng AstraZeneca para operationally wala po tayong magiging problema dito po sa pagbibigay ng mga bakunang ito.
Authorities have not changed the priority list on AstraZeneca COVID-19 vaccines allocation. Priority hospitals will still receive AstraZeneca COVID-19 vaccines for the inoculation of those who have not received CoronaVac.
Pareho pa rin ang allocation list natin. Kung sino yung una nabigyan ng Sinovac, bibigyan pa rin. Pero ngayon, dahil mas dumami ang doses natin, mas makaka-extend tayo dun pa sa ibang mga COVID referral or COVID hospital sa iba't ibang rehiyon.
The DOH also explains that although there are expected arrival of Pfizer-BioNTech and Moderna COVID-19 vaccines, the supply will still be allotted for the coverage of all healthcare workers before the inoculation of other sectors, like that of senior citizens. Undersecretary Vergara said the vaccine supply we have now isn't sufficient for medical frontliners.
No, it is not yet enough. We know that we have 1.8 million estimated healthcare workers from the hospital down to the community across the different regions of the country. We are still following our prioritization framework.
According to the DOH, after the inoculation of more than 30 priority vaccination sites in the country, next will be the inoculation plan of healthcare workers in outpatient clinics, dialysis clinics, caregivers, private hospitals, and nursing home staff. This is why the DOH says family members of healthcare workers are not yet part of the current inoculation in the Philippines.
They are not eligible. Ang binibigyan ho natin ng prioridad muna ngayon ay ang mga healthcare workers natin. Yung pong mga pamilya ng ating mga healthcare workers, dadating po tayo dun sa punto kung papasok sila dun sa ibang sektor, mabibigyan sila. Or kung hindi kaya, rest of the population.
The DOH assures if there will be enough supply of COVID-19 vaccines in the country, the 70% of the Philippine population will be inoculated to achieve herd immunity. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Austrian authorities have suspended inoculations with a batch of AstraZeneca's COVID-19 vaccine as a precaution while investigating the death of one person and the illness of another after the shots. One 49-year-old woman died as a result of severe coagulation disorders, while 35-year-old woman developed a pulmonary embolism and is recovering, it said. A pulmonary embolism is an acute lung disease caused by a dislodged blood clot. The Federal Office for Safety in Healthcare said blood clotting was not among the known side effects of the vaccine. It was pursuing its investigation vigorously to completely rule out any possible link. AstraZeneca had no immediate comment on the incident. Meanwhile, South Korean authorities said it had found no link between the AstraZeneca vaccine and several recent deaths. Health officials had been investigating the deaths of 8 people with underlying conditions who had adverse reactions after receiving AstraZeneca's COVID-19 vaccine, but said they found no evidence that the shots played a role.
Mayor Ronald Aquino of Calbayog City, Samar, and 2 police officers were killed in ambush this afternoon. Based on the initial reports received by the police, Aquino was killed, as well as the 2 cops who are yet to be identified. The ambush happened around 5 p.m. in Barangay Lonoy. Aquino and his companions were on board a van when attacked by the gunmen. Authorities are still in the area to investigate the incident. Malacanang assures the government is investigating the death of at least 9 activists in a series of raids conducted by the police in Laguna, Rizal, Batangas, and Cavite provinces. Presidential spokesperson Harry Roque made this remark after human rights groups denounced the killing of activists, which took place 2 days after President Rodrigo Duterte told state forces to kill communist rebels in an encounter. He assured the killing of 9 activists will be included in investigations being conducted by the Department of Justice-led Drug War Review Panel created to reinvestigate the 5,655 deaths in police drug war operations.
Itong latest incident na ito, iimbestigahan po natin yan. At pati po si Secretary Maynard Guevara, no? Talagang nagsabi na bumuo na nga siya ng Interagency Task Force para imbestigahan ang mga bagay-bagay na ito. I am absolutely certain na kasama po ito sa mga kasong iimbestigahan dahil obligasyon po yan ng Estado na mag-imbestiga at lumitis sa mga gumagawa ng ordinaryong krimen na murder.
A former police officer and a fugitive will finally face charges in the country after being arrested by authorities in Abu Dhabi. Leia Inagan reports why.
Former police officer Ruben Balyong has arrived in Manila today from Abu Dhabi. Balyong, who was arrested in a sting operation in Abu Dhabi, has pending warrants of arrest for murder issued by the Caloocan Regional Court and another by a Parañaque court, also for murder and physical injuries. Police verified Balyong's travel records with the Bureau of Immigration last November 5, 2020. FRIA said Balyong flew to Abu Dhabi on January 4, 2019 to work as a security officer at Star Security Services.
Nung nalaman po natin yan, agad po tayo nagpag-coordinate sa other agencies like National Center or Philippine Center on Transnational Crime, Interpol, and National Central Bureau for issuance of red notice para po natin ma-arrest itong si ex-PO3 Balyong.
Balyong was formerly assigned at the Mandaluyong Police Station 3 and has been tagged as involved in illegal drugs and identified as a contract killer. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
Metro Manila mayors intensify the implementation of health protocols and localized lockdowns in their respective areas. Asher Kadapan Jr. tells us why. Asher, go ahead.
Metro Manila mayors worry about the increasing number of COVID-19 cases in the country, especially in the National Capital Region. From about 3,700 cases on February 22, the cases has doubled to more than 7,000 yesterday, based on the record of the Metropolitan Manila Development Authority. With this, MMDA Chairman Ben-Hur Abalos Jr. said that the Metro Manila Council decided to intensify the implementation of the minimum health or public health and safety standards. This includes continuous suspension of the operations of cinemas and gaming arcades.
Napagkasundoon nila na isarado muna ang mga sinihan at mga arcade sa Kalakang Maynila, no? Bakit po? Sapagkat talagang tumataas po ang dami ng mga bilang na may pasyente.
The Metro Manila mayors also reached to a consensus of boosting the local government units' contact tracing efforts. The local chief executives have requested augmentation of their contact tracers from the MMDA and the Department of the Interior and Local Government. According to Marikina City Mayor Marcelino Teodoro, most of the cases are clusters from households. But to help the economy, they prefer to implement granular or localized lockdown of limited areas.
Maring hindi isang barangay o isang street, maring isa o dalawang bahay ay nilalockdown natin dahil upang sa ganoon hindi naman maapektuhan yung ekonomiya at yung pangkabuhayan ng ating mga kababayan.
Navotas City Mayor Toby Tiangco, on the other hand, confirmed that the MMC have yet to discuss about the restriction to minors in going outside of residence.
Wala pang napag-usapan pero sa Navotas nasa 18 years and above pa rin kami. Hindi po namin yung binaba sa 50.
Meanwhile, Caloocan City announced the re-implementation of color-coded quarantine passes in the marketplaces and supermarkets. Curfew hours will be reverted to the 10 p.m. to 4 a.m. schedule. Mayor Oka Malapitan asks the residents to get news updates about the city's policies in their websites and official social media account. Dago authorities appeal to the public to be disciplined and continuously adhering to the minimum health and safety measures such as wearing of face masks and face shields, regular sanitation, and COVID-19 vaccination. Diego?
Thank you, Asher Kadapan Jr., reporting live. Business establishments in Quezon City are now required to use the QC Pass digital contact tracing app for their employees and consumers. JP Nunez will tell us why.
Quezon City business owners are now required to secure a dedicated QR code per establishment from the Business Permits and Licensing Department. Consumers and visitors from other cities are required to download the QC Pass, a contact tracing app powered by SafePass that can help the city keep track on the visitors of every establishment within its jurisdiction. Mayor Joy Belmonte issued this directive, among others, in the revised guidelines released on March 5, 2021, to further strengthen the city's contact tracing capability amid the rise in the number of COVID-19 cases in the city. According to the Task Force Disciplina Chief, Rani Ludovica, the QR code will give them more accurate information than manual logs.
Kasi yung contact tracing form natin, hindi honest ang mga tao sa pag-field up ng tamang data eh. May nag-field up yan, mo naman mabasa pangalan. May nag-field up yan, may address eh, hindi tinatapos. Yung mga cellphone number na nilalagay, contact number na nilalagay, hindi rin naman tama.
According to the City Epidemiology Surveillance Unit or CESU, the probable cause of the spike is the non-residents working in the city. The city has recorded a spike of more than 60 COVID cases in a single day, which is a 7% increase in the previous records. Quezon City Task Force Disciplina continues its efforts to implement this rule. It already recorded 100 individuals apprehended today due to health protocol violation.
Totally pa rin na strict implementation doon sa no face mask, no face shield at social distancing. Yun at ngayon na ongoing namin, hundreds na yung na-apprehend natin. Pero this time kasi, pinakilos ni Mayor Joy Belmonte ang lahat ng station commander na mag-implement na rin, manghuli na rin ng mga hindi sumusunod sa health protocols.
The City LGU will also deploy 3,000 volunteers to help its effort in implementing these guidelines to the public. JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
In other news, nearly 3 months after President Duterte certified the bill as urgent, a Senate panel continues its hearing on the proposed department that will focus on the welfare of all overseas Filipinos. For one senator, the government must now study an exit plan for overseas household service helpers in the Middle East in a bid to stop the abuses. Harleen Delgado will tell us why.
As the Senate Committee on Labor continues its hearing on the proposed measure seeking to establish the Department of Overseas Filipinos or DOFIL, some senators still have questions on the proposed new department.
Yung problema ng ating mga OFW, recruitment agencies, employers ay mananatili na sinasabi, chinuchubibo lang kami mula sa POEA, OWA at kung saan-saan pang perya. Wag naman sanang matuloy ng ganon.
For Senator Nancy Binay, the government must study to create an exit plan for household service workers in the Middle East to address the problem of abuse against OFWs. Based on the data presented by the committee chairperson, Senator Joel Villanueva, over 4,300 cases of OFW maltreatment were recorded last year in the Middle East. More than 200 cases of sexual harassment and rape were also recorded.
This is something that needs to be funded, yung isang plano, isang exit plan para sa ating mga household domestic helpers. Kasi sa palagay ko, kahit magkaroon pa tayo ng DOFIL, for as long as we deploy especially our women as domestic helpers abroad, patuloy tayong magkakaroon ng problema.
The Department of Labor and Employment has yet to study such proposal. However, according to the Department of Foreign Affairs, it would take years to come up with an exit plan.
We have to realize, Your Honor, that
it will be really difficult for any agency to be able to stop the abuse. While we want to really stop the deployment, we have to first upskill our people, Your Honor, before we decide to stop deploying household service workers, because many of our people will not be qualified for other jobs.
For Senate Minority Leader Franklin Drilon, who's also a former labor secretary, it would be difficult to change the treatment of Middle East employers toward household service workers as long as the kafala system remains in effect.
Whether or not it's a department, it will not change anything. You still have to overcome the culture in the Middle East insofar as the treatment of our OFWs are concerned. In other words, the creation of a new department will not change the culture.
DOLA Secretary Silvestre Bello III assured they are continuously conducting training to support the upskilling of OFWs. He also noted the importance of bilateral agreements between the Philippines and other nations to ensure the welfare and safety of OFWs. Bello said a total of 42 agreements are currently in effect, while talks are underway with other countries. The Labor Secretary reiterates his support on the proposed department, not only for the welfare of overseas Filipinos, but for the local employment.
Ang nangyayari po, Your Honor, mababa yung sweldo ng ating mga empleyado dito. Kaya itong deployment process will compel our employers to give our local employees yung tamang sahod. Para sa ganun, hindi na mangingibang bansa yung ating mga kababayan. Now, if they become employees abroad, then they become the responsibility of the field. Yung man maiwan na meron ng magandang trabaho at magandang pay, then yun ang responsibility ng Department of Labor Secretary, Your Honor.
Harleen Delgado, UNTV News and Rescue. We serve the people. We give glory to God.
Good evening. Around 3,000 protesters gathered in Romania's capital Bucharest on Sunday to protest the new COVID-19 restrictions announced by the government, as well as the vaccinations which they fear will become compulsory. Marvy Delphine will give us the details live. Yes, Marvy?
LC, large crowds carrying flags, signs, and other materials with anti-mask and anti-vaccine slogans were seen in front of the Parliament building in Bucharest on Sunday. Some people were also burning their mask at the protest. Romania previously relaxed COVID-19 restrictions less than 6 weeks ago, but authorities have imposed a new round of 2-week COVID-19 control measures as the country faces a rising wave of new COVID-19 cases. The COVID-19 infection rate in Bucharest rose above 3 cases per 1,000 inhabitants over a 14-day rolling period. Starting today, bars, restaurants, theaters, gambling venues, and cafes will close, while schools will revert back to online learning, while pupils in nursery and primary school, including those from 8th to 12th grades, will continue with physical attendance, with operation only at half capacity. Residents in quarantined areas are required to fill out an official form stating the reason for their movement. There is also a lightly enforced curfew between the hours of 11 p.m. and 6 a.m. On the other hand, the COVID-19 vaccine is not mandatory and is provided free of charge in Romania. Those who have received the vaccine are entitled to fewer COVID-19 restrictions than others, and this has riled up demonstrators. Opinion polls across the nation of more than 19 million people continue to record a high level of skepticism surrounding the COVID-19 vaccines. Elsie?
Thank you, Marvy Delphine, for that live report. The head of the Catholic Church met Iraq's most eminent Shia Muslim cleric in an interfaith meeting of his historic visit to Iraq. Early Briones reports.
Hopes for religious coexistence was appealed for after a meeting between Pope Francis and Grand Ayatollah Ali al-Sistani, senior Shia cleric of Iraq. The Pope, in his tour of the country, traveled to the city of Najaf, where a 45-minute private meeting between the two was conducted in the home of Al-Sistani, discussing spiritual leadership in addressing humanity's challenges, including poverty, oppression, and injustice. Al-Sistani, a well-respected individual who by locals and those overseas is regarded as an influential person in Iraq's modern history. His words moved thousands into fighting back against ISIS in 2014 and resulted in the resignation of ex-Prime Minister Adil Abdul Mahdi in 2019. After the momentous meeting, the Iraqi Prime Minister Mustafa al-Kadhimi posted on Twitter the naming of March 6 as the National Day for Tolerance and Coexistence. Meanwhile, although the Pope has had 2 doses of the BioNTech-Pfizer COVID-19 vaccine and his entourage will have been vaccinated, health experts fear the impact of large crowds on efforts to contain the pandemic. Dr. Navid Madani, a virologist, told AP that the welcome for Pope Francis could potentially lead to unsafe or super-spreading risks. For the Vatican, the trip furthers the Pope's efforts to strengthen relations with the Muslim world, extending his message of encouraging fraternity and social friendship. Early Briones, UNTV News and Rescue, we serve the people, we give glory to God.
The United Nations Human Rights Office has not received any evidence from the United Arab Emirates that Dubai's princess is still alive after 2 weeks since seeking proof. Maeve Dog will tell us why live. Yes, Maeve?
LC, the UN has asked for proof of life of the daughter of Dubai ruler Sheikh Mohammed bin Rashid Al Maktoum after a video shot by the princess was broadcast by BBC this week. UN High Commissioner for Human Rights spokesperson Rupert Colville said they have held discussions with representatives of the UAE government, but proof of life of the princess had not yet been received. UN High Commissioner spokeswoman Liz Throssell called the video evidence disturbing, wherein 35-year-old Princess Latifah said she feared for her life while being held captive in a villa jail in Dubai. The family, however, claimed last month that she was being cared for at home. Furthermore, in a handwritten letter by the princess from 2018, which was only handed to the police last month, Princess Latifah urged the British police to reinvestigate the disappearance of her sister Shamsa. Shamsa was reportedly kidnapped on the orders of their father after she fled the family's Longcross estate in Surrey over 2 decades ago. Meanwhile, Sheikh Mohammed has since then repeatedly denied the allegations. He said he was acting in the best interest of his daughter. LC, however, a UK High Court has refuted what he said and found that he has orchestrated the kidnappings of his 2 daughters, and as stated by the UK Family Court, continues to maintain a regime whereby both these 2 young women are deprived of their liberty. Back to you, LC.
Thank you, Maeve Dog, for that report. Singapore has built a floating solar farm as the country's plans to combat climate crisis and greenhouse gas emission reduction. Ia De Vera will tell us why.
A newly built solar farm in Singapore has 13,000 solar panels that has been laid out to the country's sea and reaching Johor Strait, which separates the country from Malaysia. The floating solar farm has the ability to produce up to 5 megawatts of electricity that can supply enough energy to at least 1,400 residential flats for an entire year. According to Jen Tan, Senior Vice President and Head of Solar in Southeast Asia at Sembcorp Industries, the next big potential is Singapore's water area after using rooftops and the ground. A Singaporean company is in charge on carrying out the project and presented a solution for a country with limited space on producing renewable energy. The effort has been made by the government to address its record as one of the biggest per capita carbon dioxide emitters in Asia. But renewable energy is a challenge in a country with little land space, with no rivers for hydroelectricity and wind power. According to the Climate Action Tracker or CAT's analysis, while Singapore has strengthened its effort to fight climate change, its 2020 and 2030 targets have been classified as highly insufficient. Also, the organization said that despite Singapore's expansion on renewable energy, natural gas remains the dominant energy source in the country, accounting for 96% of electricity generation. Iya De Vera, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Elsie Marcos, live from Auckland, New Zealand. Good evening.
And those are the reasons behind the news, March 8, 2021. I am Hardin Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.